Hi guys, I'm Dr. Aman Arora from Arora Medical Education. I train a lot of doctors and trainees for role-play based medical exams, things like plab 2, RCA, CSA. And one of the commonest questions I get is, can I ask a double question in data gathering to try and save time? Now, in these types of exams, any role-play based medical exam or OSCE, you have very little time to do your data gathering or your history, sometimes 2 minutes, 3 minutes, 4 minutes. And often we're trying to find as many ways as possible to cut that time down to allow us to have more time in the second half. One of the commonest things that I see is that people try and do double questions to try and save time. For example, Mrs. X, can I check if you smoke or drink? Mrs. Y, can I check if you've lost weight or had any change in bowel habit? Mr. X, can I check if you've had a cough or any shortness of breath? So often I see these double questions, and when I was doing my CSA preparation myself, I started doing double questions as well, thinking it's a great way to try and cut down time. Now, personally, I don't have any pros and cons as to whether you should or shouldn't do this, but the one thing that you've got to be confident about is that the answer that you get from the role player relates to both parts of that question, and that is not often obvious from the answer that you get. Let me give an example. Mr. X, can I check if you smoke or drink? Now, when I do that, and the patient might say, no, doctor. Now, I would sit there and think, in my mind, okay, does that mean no to both? Or does it mean no that they smoke? But what about alcohol? Was the answer covering everything? Or do I have to go back and check? So in the end, most times, because I wasn't confident that the answer related to both questions, I'd go back and clarify. Mr. X, do you mean no to smoking? But what about alcohol? Oh, no to both, doctor. Right, okay. And then I'd move on. Now, it was very rare when I was doing this that I actually found that the answer that I got to a double question left me confident enough that it related to both parts. Say, for example, you're doing red flags. Mrs. X, can I check if you've lost weight or had any change in bowel habit? And they say, no, doctor. How are you confident that it means no to both weight loss and no to change in bowel habit? Number one, if it didn't relate to both, and it was just the first one, then you're going to miss the fact that they've lost that they've had some change in bowel habit, which could change the whole case. Or you're going to have to say, hold on, do you mean no to weight loss? But what about change in bowel habit? No, doctor, not to that either. Okay, it was both, and then you move on. Either way, I've lost time. So one thing you've got to be really careful with, I don't have a preference as to whether you do double question or not, but I would say that you've got to make sure that the answer relates to both. Now, in some instances, you might get an answer that's clearly related to both. Mrs. X, can I check if you smoke or drink? No, doctor, I don't do either. Okay, that's great. You're confident, no, not to either of those, so I know it's a double negative, I can move on. But most times, having trained people for exams like this for 10 years and multiple hundreds and thousands of role plays, most times you don't get an answer that leaves you satisfied that both of those parts are negative, and therefore you end up double checking, or you miss the fact that the second part was actually positive. Really dangerous when you think about it. Could be a red flag that you're doing that completely changes the case going forward. So when you're doing your role plays and practices and recordings for whatever exam that you're taking, think about, are the double questions that I'm using to try and save time actually losing me time, or possibly making me lose things and miss out on vital information that could change my case going forward? We do loads more of this type of teaching for common questions that come when it comes to role play based exams on our day courses, our online courses, our audio courses as well. Have a look at the website, aroramedicaleducation.co.uk. And just for having watched this video, you can get 10% off by using a code AroraVideo10. If you're going to book onto any of those courses or use our online or audios, make sure you get that 10% off AroraVideo10. And when you do your practicing going forward, make sure you spot yourself if you do double questions. Remember, it's not right or wrong to do double question. The key thing is you've got to be confident when you come out of it the other end that you know that both parts of those things are negative before you move on to the next part of your data gathering. Try it, practice it, and note the answers that come, and note whether it actually saves you time or whether it actually adds to your time, because you have to go and clarify later on. Really hope this helps. The hashtag CanPassWillPass, hashtag I went with Arora. Pay attention to your double questions. Have a good day.